All right, thank you guys so much, and thanks for attending. I am very excited to present here today and just to be a part of the group. I was in the PhD program up until recently, so I wasn't able to participate much with Annie, but I've been watching y'all for a while, and I'm really proud of all the work that y'all have been doing. So today I will be presenting most of what I've done during my PhD studies. And it's just the beginning of me as a nurse scientist, I hope, of course. But it did focus on fluid intake, hydration status, and environmental heat stress among North Carolina farm workers. So from 2000 to 2010, agriculture workers were 35 times more likely to die from heat-related illnesses, and we call them HRIs. And the concerning part, especially to me, was that is a huge number. And then you break it down, and Latino workers were at even higher risk, with a relative risk of 3.4 compared to other agriculture workers. So, there's around about 1 million farm workers in the U.S. every year, and there's about 85,000 in North Carolina. We're one of the top states, California, Florida. So this definitely highlights the risk for the farm workers, not only in the U.S., but in North Carolina. And as many of y'all may know, HRIs range from mild to extreme conditions or severe conditions, and one of those is heat stroke. And heat stroke has a 50% 28-day mortality. And again, some things that you likely know, but 2016 and 2020 were tied for the hottest years on record in the world. And 2019 was the hottest year ever reported in North Carolina. And likely 2021, I think we just had the hottest July ever in the world, right? So it might break records as well. So in southeastern United States, by the year 2100, the number of days above 100 are supposed to go from 3 to 60. So a very big jump. Again, numbers you guys might already know, and that's what 80 years from now, but already climate change is affecting HRIs, and the rates are rising. So staying hydrated is one of those basic fundamental behaviors that you can do to help control heat stress and prevent HRIs. And farm workers report barriers to fluid intake. There's a qualitative study in 2013, which was repeated over and over in literature review papers that I've done, because that was really the biggest article I found as far as the greatest focus on fluid intake. But in that paper, some of those barriers included poor relationships with their supervisors, short or no work breaks. Their toilets were far away, and also a barrier was the quality of the water that was provided to them at work. So, seeing some of the names on this call makes me think about, this next information here, that farm workers are dehydrated on the job. There have been 2 studies that I have found that specifically measured hydration status. And in Florida, 53% of the sample farm workers had a pre-shift urine specific gravity that indicated dehydration, and that increased to 81% post-shift. And in California, they've done work using body mass, and over half of their workers in that study had a body mass loss over a shift that was greater than 1.5%, and that's when the risk for HRIs increase. So there's not much information in the literature. There's more HRI literature related to farm workers than there is hydration status and fluid intake. But from what's there, we know that, farm workers know that heat and dehydration can cause health problems. I think many people know that, but they know this despite never really receiving formal HRI education or information at work. They do know water to be the healthiest thing to drink compared to like sodas, etc. But overall, again, Lamb still reports that there is a knowledge practice gap regarding hydration, as far as farm workers know what to do, but they don't always follow that knowledge. And in North Carolina, there's been no specific focus on North Carolina farm worker hydration status or fluid intake. So again, most of the research is on HRIs themselves, the symptoms they experience, what affects, how they feel, and the prevalence, etc., but none with a specific focus on hydration status or fluid intake. So I wanted to add a little bit more about community-based participatory research, and I just want to make sure you guys know I'm not an expert, right? This is a very complex research design, which, when you're new, they all seem complex, but I think a lot of people appreciate community-based participatory research because they know it will lead to improved health, and particularly because it could potentially reduce health inequalities. So we're focusing a lot of nurses in particularly, right? We're really tuned into social justice and helping those healthcare inequalities or healthcare disparities. So I was drawn to this, and of course my mentor has had research with this design before. But community CBPR, it requires more than just research. So you have to commit to several other things, which really many people would argue you should probably do anyways, right? You focus on, and these are the 9 principles that were from Israel in 2013. That's a pretty commonly cited text when it comes to CBPR. And as you can kind of read through, it's all about community, and the identity, and the community is the center. The partners work together. It's a cyclic iterative process. It's a long-term process. And it has to benefit the community. So some of those things we should always consider when we're doing research, but particularly the long-term process is always something that could steer people away from CBPR. For my particular project, I can admit that we did not do a full CBPR. So you'll see me refer to it as a community-informed design. So we did 4 of the 9 principles. But a big piece of our project was that we paired up with a federally qualified health center, and we developed an equal partnership. We developed the research together. It wasn't something I came in as a researcher and wanted to do. We discussed problems and, energy saving lights. There we go. We discussed the problems in the community and developed this project together. And this is just to give you a little bit more information about the timeline. We began meeting back in 2018. And then we conducted a pilot in 2019, and then conducted the mixed methods study in the summer of 2020. So it does take a while to develop partnerships and conduct CBPR, but we believe it's going to be the most beneficial. particularly when you work with Latino, and I know you guys know these things as well, but when you work with Latino farm workers, there's a lot of vulnerability in that population. So you need to develop partnerships, and particularly with groups that already have established trust with your participants. So we partnered with a federally qualified health center, and they had a migrant health program. And this migrant health program, you know, definitely in the summer works a lot with the migrant farm workers, but it's also the seasonal farm workers. And it's been the same community outreach workers year after year. And of course, many of them share cultural and ethical similarities to the participants. So trust was established. So when we met with them, we discussed the problems, like I said, and I was concerned about heat and agriculture workers, and they suggest working, particularly focusing on the farm workers because of their increased exposures to environmental heat stress. So our pilot study was first to explore the farm workers' perceptions of on-the-job hydration, and we did a qualitative descriptive study. So it was definitely a pilot study with only 8 Latino participants, but with qualitative research, you can get a lot of great data with just a few participants. So we had 2 females and 6 males, and they lived in 3 different counties. And with the individual interviews, we then used content analysis. So there's a lot going on this slide, but just to kind of give you the findings from the pilot study is we found a major theme to be employer control and farm worker agency. So I'm going to talk later about power and power balances, and we found that a lot, even when it came to the concept of fluid intake. I think when we started this project, we thought, well, fluid intake and heat stress, that's fluid intake, something the farm workers can control when it comes to their job. So we were surprised to also see a lot of power dynamics and agency issues when it came to drinking water. So the overall, to sum it up, is that the employers chose the crop. They also regulated the breaks and conceded fluid intake. So they would allow their workers to drink or not, depending on what was going on. And then the farm workers themselves, they really wanted their job. So they limited their breaks and they sacrificed hydration. We also included some quotes there. The first one related to the fluids that they drank included the boss man, no water, no cooler water, no way for cleaning the hands, no special clothes for sprayer, special boots, no cover for face. Bring nothing. Why? I don't know. So that was one quote, and that brings up a lot of issues related to occupational policy and safety. So this led us into our second project, which was the mixed methods project. And we kind of thought that a lot of our findings were related to farm worker culture and farm worker place. So workplace, home place, things like that. So you can see in our aims, we're going to talk a lot about culture and place. And because it was mixed methods, we also had 2 aims, one for each phase of our project. So we had the first phase, which was qualitative, and then the second phase, which was quantitative data collection. So aim 1 was to describe the factors Latino farm workers believe influence their fluid intake. And again, questions about culture, workplace, and then environmental heat stress. And then for aim 2, the quantitative phase, we wanted to determine the relationship of hydration status to farm worker characteristics, behaviors, and environment. So we did prevalence of pre and post like they did in Florida. And then we determined, we looked at associations between culture and workplace and wet bulb globe temperature, which was something I really enjoyed about this project. I thought it was a little bit more unique, and we'll talk about that. And then we also did a beverage intake questionnaire. So we, for our theoretical framework, it was, the study was informed by intersectionality theory. So you may know what that is, but it's credited to Collins and Bilge and Crenshaw. And it is a holistic representation. So, you know, nurses, we like holistic things and, you know, considering the whole person, but it's a representation of a marginalized worker bounded by social identities, some kind of social and or ecological system. And there's 6 different concepts. And again, back to power, social context, social justice. So those were all considered, particularly when we were analyzing our data. So it's a big mouthful, but community informed sequential exploratory mixed methods, right? So that means we did the qualitative first and then the quant second. And we had qualitative focus groups for phase 1, and those we collected the beverage and the demographic, wet bulb globe temperature, and then the hydration status measures in phase 2. So we had a goal of 4 to 5 focus groups, so about 60 participants for really pretty much both phases. Those were our goals, and we knew convenient sample was likely what we would have to do for the phase 2 for the urine sample, the quantitative phase. And in case I haven't said it already, the setting is Eastern North Carolina. It's a big agriculture hub of North Carolina, and we are one of the top agriculture states in the nation. But particularly in my area, it is one of the poorest areas of North Carolina as well. And it was also the service area for the FQHC. So these are 6 different counties, but there are a great number of farms and farm workers in this area. And the team, I spoke a little bit about that, but that included 2 of the FQHC staff, and so they served as one of the co-moderators, and then I served as a moderator for the focus groups, and we had semi-structured questions, and we did most of the focus groups in Spanish because that was the preferred language. So for phase 2, I got to pull out a lot more of my nursing skills. You know, as far as urine specific gravity and collecting urine samples, I think we've all done as nurses maybe at some point, but we chose urine specific gravity to measure hydration status because it is quick and non-invasive. It is reliable, of course, not as reliable as blood markers, but it's widely used in both field and clinical settings. So we have, of course, I had to educate the participants on how to do a clean catch urine specimen. We collected the data over 4 different days in a week's time, and it included both morning and after shift, so pre and post shift urine specimens. And then we also collected the survey and the questionnaire. But in order to measure the urine specific gravity, we use a digital refractometer. So there's different ways you can do that as well, that range from reliable to not so reliable, but a digital refractometer is something you can take into the field, and it's very reliable. And we also use reagent strips to make sure that these specimens didn't have high levels of glucose or protein or something really heavy that would affect the urine specific gravity results. I also went into the field, so you can see this is tobacco field. We have a lot of tobacco cucumbers, and sweet potato crops in my state. So this is a tobacco field, and we followed the directions to measure wet bulb globe temperature in the field. So we followed the policy of the machine. I'm trying to think of the word here, but anyways, wet bulb globe temperature compared to like temperature and heat index is the preferred heat matrix for preventing HRI and occupational groups because it's more accurate, and it includes it calculates what it would be like in the sun versus heat index usually only calculates what it's felt like in shaded areas. So it is basically more accurate. And this machine here logged the wet bulb globe temperatures every minute. And then we got hourly means from that. And then the beverage intake assessment questionnaire is a 32 item, and it asks a lot of questions about beverage intake over the last month. So frequency, timing, quantity, type, lots of questions, but it was developed in Spanish. So that's why we chose that one. So of course we developed transcripts. We chose content analysis to analyze the focus group data. And we also included, the FQHC, they worked with us during every phase of the study, including data analysis. And we did things like member checking and verbatim transcription to help improve the rigor. So we used SPSS for phase 2 and included descriptive statistics, Pearson's correlation, paired sample t-test, and independent sample t-test. So in the nature of mixed methods, you have to integrate the data. So we used a meta matrix to compile phase 1 and phase 2, as well as our notes as we went throughout the project in a meta matrix, so we can compare everything simultaneously. So we invited a total of 32, and we got 28 for phase 1, and we had 4 focus groups. The mean age was 39, and they were all men, even though we started out wanting men and women, migrants and seasonal. We only ended up getting men and migrant farm workers. But they lived in 3 different counties. And then for phase 2 is about the same, and many of the participants were the same for both phases. So we had 30 Latino farm workers participate in phase 2, and the age was about the same. So our theme from phase 1, we had 2 overall themes: absence of protection and freedom to drink. So within absence of protection, intense climate considerations and workplace exploitation were the sub-themes. So farm workers consistently thought that extreme heat, so when we asked them, extreme heat was always the greatest barrier for them to stay hydrated while at work. They always worked long hours on hot days without many breaks at all. And those who worked in tobacco specifically reported that the height of the crop blocked the wind, so that increased their need for water. They also described being powerless and exploited, although of course, if you know some things about Latino farm workers, is they're not gonna outright admit things like exploitation, but they did describe scenarios like that. And they focused a lot around their payment practices, their employer, how they paid them, and like where they get paid by the piece, which is if they pick a whole lot of cucumbers, they get paid per bucket instead of by the hour. So that incentivizes them to, work faster, take fewer breaks. And there was also a lot of discussion about the H-2A visa program, which is a federal program that essentially brings farm workers to our area from other countries like Mexico and Central America so that they can fill jobs that are vacant that many Americans don't want to do. So there's a lot of discussion about the power systems and everything involved in the H-2A visa program. There's lots of policies too involving their houses and water and different things with that program. And then with freedom to drink, they always perceived, freedom to drink whenever we asked them. They're never in need for water at work, is what someone said. Yet they also reported water not being accessible or nearby. And then to compensate for those short breaks that they were given, maybe 1 or 2 breaks a day, they gulp water really fast and then their stomach fills up, which is this quote here. Even though your stomach is full, your mouth gets really dry and you still want to drink more water, even though you feel full. So particularly people working in the sweet potatoes reported that they couldn't drink a whole lot because they were constantly bending over to pick, and they had to balance those negative feelings of like nausea. They also had reported poor water quality both at work and from the houses that they lived in. So remember the H-2A visa program, the employers provide the houses. So they felt the house did not have good water, and many chose not to drink it. They also preferred other beverages to water, especially sodas. Sodas were very popular. So for phase 2, this is the urine-specific gravity. We categorized urine-specific gravity by the National Athletics Trainers Association, and this is done in several studies, but you can see here that, I'm always quizzing my bachelor students, is the urine-specific gravity supposed to be low or high, right? So high is a bad thing for urine, so that's more concentrated. Above 1.03 is severely dehydrated, and 0.02 to 0.029 is moderately dehydrated, and less than 0.02 is what we consider normal. So about 50% were dehydrated before the day even started, right? And then after the shift, all of them were considered dehydrated or severely dehydrated. And this was a significant change over the shift. Overall, they reported 4 liters of fluid per day, which for me and you is a huge number. Okay, but it still was not enough for them to stay hydrated on the sample day. And that includes 2.5 liters of water and 4 liters total. So Gatorade, sodas, etc. It also included things like soup and lots of different things. And then the wet bulb low temperature, the average on the 4 days was 84.5 degrees, and the max was 93. So this number is typically a little bit lower than heat index. So this is still very hot. And then we also compared those numbers to the American Conference of Governmental Industrial Hygienists. That's a big mouthful, but it's the threshold limit values, if you've ever heard of those, the TLVs. And this group, this provides us with a measure, like a cutoff, right, of workers are okay to work in this, and then they're not okay to work in this. So we compared it to that. And it gets a little complex because you have to include things like what they wear, and how hard they work. So we had to estimate all of that. to come up with a calculation. But once we had done that, we figured out that they spent 2 to 7.5 hours of the day working above those limits, so above levels that they really shouldn't be working in. And that was about 50 to at least 50% of the day. Some of them it was 100% of the day. The interesting thing is that they surpassed these limits much earlier in the morning. So they started work at 6 in the morning or so, and by 9 o'clock or 10 o'clock, they were already past the limits. So it wasn't just the afternoon. And then an honor student who worked with me looked at the proteinuria, and of course, proteinuria can mean a lot of things, kidney function, stress, heat stress. So, it would take a lot more blood data, et cetera, to kind of come up with a conclusion, but there was a significant shift in the incidence of proteinuria between pre and post shift samples. So this could have been from exercise, but when we begin to have the discussion, right, of chronic kidney disease of unknown origin, CKDU, this is really where my brain starts to go and think about their kidney function. And that is the chronic concern of dehydration. And we did actually find one participant out of, it wasn't many, right? It was 30. One of those had 4+ glucose, which is not typically found in patients that don't have some kind of diabetes or some other severe disease. So that they were referred to for follow-up after that finding. And there was a few positive correlations, and that included average hours worked per day and post-shift urine specific gravity. So they became more dehydrated the more hours they worked on a typical day. And then there was a moderate positive correlation between weeks worked this year, so how late in the season they were, as well as hours spent working above the TLV, so that environmental heat stress, with the post-shift urine specific gravity. So this is, again, another busy slide, but this is the meta matrix, or at least the summed down version of our mixed methods comparison. So, it includes the qualitative data and the quantitative data. We found correlation, common findings in both phases regarding extreme heat, as well as water breaks. So they reported intense heat and infrequent breaks in phase 1, and the wet bulb blood temperature in phase 2 suggests that the breaks that they're getting, they're not long enough to stay within the recommended levels. So if you're given longer break, you're not working as hard, so your TLVs come down. But in their situation, those breaks weren't long enough to accommodate that. As well as housing, we found housing was a commonality between the two. So they described poor housing in the focus groups. And then that, coupled with those long work days and the high prevalence of pre-shift dehydration, makes us start to think that, they're not rehydrating when they go home, or maybe in the morning before they go to work. And that happens in their house typically. So that kind of warrants exploration of the farm worker housing. So I think our study provided a greater understanding of farm worker perceptions of their fluid intake, especially water. We got in a little bit about sodas and beer, etc., but we found out a lot about water intake. We also have data to support that they're not drinking enough to meet the NIOSH standards. So NIOSH is National Institute of Occupational Safety and Health, right? So this is an occupation, and they recommend that workers drink 1 cup of cool water every 15 to 20 minutes. And in phase one, when we ask them, they do think they're drinking that often. So it's unclear why they would need to drink large amounts of water at once. Remember, their stomachs got really big and uncomfortable. So it's possible that maybe they're overestimating their intake frequency, or just, providing a socially acceptable answer. But also the beverage questionnaire, when we did that data, that did not suggest that they're drinking enough. So, in focus group, they thought they were, but when we wrote it down on paper, they were not. And even though that number was huge, right, it was 4 liters. When we break that down per hour, they're only meeting the standard for like 5 hours of their workday. So they're still not drinking 1 cup, probably, right? They're probably not drinking 1 cup every 15 minutes to help prevent HRIs. This also kind of supports, they just need longer breaks. This would cut in, of course, to work, but fluid is not enough to protect them from HRI. So longer breaks, air-conditioned areas, I think is something we can take away from these findings. And there's also a lot of information here with the intersectionality theory, as far as like social categories and power systems that are at play. We found a lot of things that had to do with ethnicity, migration status, the employer-employee power dynamic. And then, there's been some studies in California, Wadsworth, again, farm workers want to be known as good and hard workers. So when we think about interventions for this group, we've got to remember that, they're going to do their best to be known as good and hard workers, and but that also leads them to be at risk for exploitation. And maybe down the road we can explore the H-2A visa program a little bit more, and if there's any more policies that we can do to protect workers that specifically are here within the H-2A program. There was a study in North Carolina, but it's almost 10 years old now, so like 15-year-old data. But even back then, about 1/3 of the houses, H-2A houses, the samples that came out of those houses, they did not meet North Carolina quality standards, the water there. So if we tested it today, what would we find? So, there's not only a lack of occupational policy, so there's also some enforcement issues. So employers are supposed to have water nearby. They can't just have it, they have to have it nearby. And that wasn't always reported with us. There's a few states, I think every time I check, a new state comes in that they have a specific policy for HRI occupational protection. California, Maryland, I think, is a new one. Washington, I don't have my list in front of me, but it's only a few. But everyone's kind of catching on that this is important. In fact, there was a study in California that with 259 farm workers, and it gets hot there too, and no one on the day of data collection had HRI symptoms. And the authors of that study think it's because California has an HRI prevention policy on its books. So there is one on the national level that's currently in Congress. So maybe Annie can help us, or maybe you guys already are helping push this policy through. There's some neat information about microclimates. I believe there's been one study in Florida that actually measured wet bulb glow temperature near the participant, right? Most of the time, anytime a wet bulb glow temperature is collected, it's usually at the airport or several miles away. So a lot of the chronic CKDU research has wet bulb temperature from several miles from where the actual participants were. So we were able to collect that in this study, although small. We at least have a little bit more microclimate data to support that, you know, the tobacco crops, these really tall crops, are probably increasing the heat stress that these these workers are experiencing. And this was, you know, to reiterate, this was the first North Carolina farm worker study to collect physiological markers of hydration status. So, you know, it's being done in Central America related to kidneys, and it's been done in Florida, but this is the first one in North Carolina that I'm aware of. And even though Florida is a tad bit hotter, we had very similar findings compared to the dehydration prevalence. And again, I was surprised about exceeding the TLVs in the morning. So I think I mentioned this, you know, I really do think policy, speaking with other environmental health people in North Carolina, particularly farm workers, policy is really what's going to help farm workers because of that power mismatch in their jobs. But we could also look at the public water systems. You know, rural public water systems are failing across the US. So what can we do to build up that infrastructure? And then other things include, of course, education and improving the farmer and farm worker relationship. So I'd like to see, you know, my research expand to include lots more observational and physiological measurements. So, you know, the groups in Florida collect a lot more measurements than we have. So I'd like to beat that up. And I'm especially concerned about kidney function, both acute and chronic in the farm worker population. And nurses have to lead the change, right? We can do it. So I want to make sure I put the acknowledgments in there about the participants and the FQHC staff and our funders for the research. Thank you very much.
That was great, Liz. Really super interesting. And Luz also made that comment in the chat. I think there are probably some people that have questions. We have several people here who do this kind of research. And so anybody out there want to ask any burning questions? We have about 7 minutes left.
This is Barb Lipka. It's really interesting. I was really curious that you were collecting this data during the pandemic. How could you talk about how that was impacting what you were and were not able to do?
Absolutely. So, of course, we had IRB approval, but within that IRB, we had a very specific COVID infection policy. So, you know, the focus groups had to be distanced and masked and cleaned. You know, we had protocols for each part as far as distancing and the disinfection. As far as the urine samples, it was not what you'd expect from a nurse, a nurse patient basically interaction, right? So it was very much put your urine in the box and we'll come get it, you know? So, you know, it impacted a lot of different things as far as trust and, you know, reporting the results, and, you know, it went on and on, but we made adjustments and we kept everybody safe. So that was the end
I'm
goal.
impressed you were actually able to collect your data during the pandemic because so much was shut down during that period of time. Were the workers having to wear masks at all during any of their workday? And could that, if they did, how did that impact any of the?
So from the limited of course we observed because we were in the field that they were working in. But from our observations, we did not see anybody wearing masks. But I think you could understand why they didn't, as far as the heat and the hydration piece goes. They all live together, right, in tight quarters. So there was probably some smaller concern about spreading it because they live together anyways. But no
Did they wear gloves when they were harvesting the tobacco plants? Since I've heard that the tobacco can pass through the skin through dermal absorption.
Yes, and then in the morning, that's another piece that made our research a little bit more complicated because they wore different things in the morning versus they wore that plastic protection. I forget the official name right now, but they wore that for a couple of hours while the tobacco was wet because that definitely increases the exposure and the risk for that green nicotine poisoning. But
did anyone wear any?
Time they just wore gloves, so they took the plastic off, and the rest of the day they wore either a thick glove, like a gardening glove, not plastic.
Did they wear any kind of heat cooling vests or anything?
The FQHC had given out a few of like the cooling bandanas. I didn't observe any of those being used, but I think what I would describe as the typical outfit of the farm worker was like the big hat, the long sleeves, thick boots, thick pants.
Daniel, do you have a question?
I did. I was just curious how you were investigating, or if you had plans to investigate the microclimates further that the farm workers were experiencing.
I think the understanding is like that inside the tobacco crop is like 15 degrees hotter than outside of it. And I don't have a research article to prove that. Now, if any of y'all do, I would love to see it, but I would like with my heat stress monitor, I'm considering, whereas we set ours up at the edge of the field, right? So there'd still be some flow of wind, and I'd like to set it up inside the field and compare those two. And then of course, California, I think is it California that they have the little buttons that you wear different places that can measure the microclimate. Those are not as accurate as this heat stress monitor. That monitor is very expensive and it's a lot more accurate than those individual ones, but there's pros and cons to everything that we do.
Any last minute questions? We have 2 minutes left. I think this has been so interesting and sad to hear what people live through as they're trying to make their work. I felt, as you're sitting there talking about the tobacco farms, thinking that this is, Daniel and I were texting, it's like modern day slavery. It's not the same in that the slaves were brought from Africa against their will to work in a field in terrible conditions. And, these are migrants that choose to come here out of poverty and climate change and whatever else brings them here. And I, do my work in Guatemala, and I know the conditions in which people live in rural areas, and they're, dire poverty. And so they may come to these places and think it's a step up, but actually, in fact, it's slavery. I mean, it's the way that they're running and being paid, low wages and working under these conditions, and they don't complain, which just makes me crazy. So I really thank you for, putting that out. And I know there's a lot of us here that are interested in this topic, and I'm glad to have you participate. And hope that you'll be with us next month for next speaker, who I don't remember who it is. Liz, do you?
I think it's Dr. He was here.
Okay, all right. So
Yeah.
maybe he was testing the crowd. Yeah, right. So and he right. So we're gonna have another opportunity to hear from more research next month. We're really glad you came today, and thank you very much to coming to our research working group for the Alliance of Nurses of Healthy Environments. And now I'm going to turn off the recording. Goodbye.
Thank you.
Thank you.